Welcome to North LA County's Regional Centers Town Hall on social rec camp and non-medical therapies. We're going to cover a lot of area today around our services that we offer, how we make these decisions, and making sure that we get a lot of information out to our community around where we are. And before I move on, I want to just do quick introductions. Sylvia introduced me, but I am Jesse Weller. I'm the Deputy Director here at the Center. And I am accompanied here today with some great staff. And so we have, let me go down the list here. I see Ruth Jenka, our Executive Director. I see Gabby Ashrati, our Consumer Service Director for the branch offices. Christina Pruz, Consumer Service Director for Early Start School Age in San Fernando. Jasmine Zinnerman, our Consumer Service Director for Transition Adult, San Fernando Valley. I see our new Public Information Manager, Robert Dundrup, who's with us today. Anna Maria and Sandra Rizzo, Executive Assistants here at the Center, who will be supporting us, along with Sylvia Bonilla, who you got to hear from. And then I see Maria from Community Services. And then I see our Jennifer Williamson, our Organizational Development Director. And then I see our Interpretation Services, Patricia. I think I captured everybody, just so you know who's on the panel. And all right, so we got our introductions, and then we can go to slide 2. All right, everybody. So first slide here, really exciting news. The reason we're here today is to talk about really important services for our families and our consumers that regional centers now have the authority to purchase for families for social recreation, camp, and non-medical therapies. We used to be able to purchase these services many years ago, and then that was frozen and restricted. And now we are able to do so again, which is a really big win for our community. And since this became into law again, there was a lot of steps that regional centers need to take, including creating and getting approval for policies, which means how our regional center is going to approve and implement these services. And we're very pleased that the department approved our policies at the department level on March 23rd. And so that really prompted us to be able to have our town hall today so we could provide you all the information now that we know we have approval, which is exciting, and that we officially can offer social rec, camp, and non-medical therapies. Before I move into our presentation, I wanted to acknowledge and give thank you to some individuals. One, Ruth Jenka, our Executive Director, for helping support the vision to find ways to make these services that we're going to talk about today the most inclusive and the most available for our community. So Ruth did a lot of work with other regional centers, getting information that can be practically implemented, that can really help benefit, so we could find ways to make this more available than restricted. I also want to thank our Board of Trustees for adopting our policies. We had a lot of support from our board members to also support the exciting stuff that we're going to cover today to make these more available, these services more available to our community. And I also want to thank the Department of Developmental Services for supporting and approving our policies and the work that their team has done to not only review ours, but many other regional centers in an expedited fashion to be able to approve and to go through not only looking at the policy, but making sure it's supported by law, regulation at both the federal and the state level. So there's a lot of work that goes into any kind of change, and there's a process that needs to follow when we implement services. And so I just wanted to start there. And then for the purposes of today, we can go to slide 3. We're going to be talking about camp, social rec, and non-medical therapies. And the way this presentation's set up is to first start with looking at these services that you'll see in our policies as an exciting way as a family support service. So North LA, and this is language from our policy here, but it's letting our community know that we are able to provide camp, social rec, and non-medical therapies, and we'll talk about those in a way that can provide family support, almost like respite or care and relief from the supervision. If family members or consumers that we serve choose to have this type of service. And you'll see it broken down a little bit more coming up. But this is new. Now that we have these services, primarily what we've seen is respite, personal assistance, and daycare as our most common family supports. Now we get to add more options for families. And you'll see on the next slide, coming up here on slide 4, that the first great addition is that we can offer camp as a family support. And so we included here, and this PowerPoints will be available in English and Spanish. We'll get it to our whole community. And we also included the service code. It's more internal, but it's a request that we get to make sure that we have all the information in one area. And so when we talk about camp as a family support, there's still that IPP program planning, where we still do service coordination, we do planning. And one of the options could be that North LA will authorize a camp setting as a family support for both children and adults. Really important distinction that this is for both children and adults when there is planned relief that's needed for a parent or caregiver to get a break or to get relief. A camp setting could be used as one of those options. Families can still choose respite in their home, participant-directed services of who's providing that service. This is just another option that families could add into their program planning, working with the service coordinator that we're able to do, that's been approved by the department in terms of a family support. So that's one of the new exciting additions that we're able, when we talk about restoration, coming back what we used to do, we now can offer camp as a family support. And towards the presentation, I'm going to cover where we are with vendors and providers. I'm going to cover that area as well with the team. But right now, I'm just going to go over the services that we have approval for. So that's the first one, camp as family support. The next one we have approval for is camp, a camp setting, camping when it's used as a form of daycare. And you'll see the description here that daycare, when we talk about daycare, it can be for both children and adults. And these are for parents or caregivers who are working. They have employment, or they might be going to school to be able to achieve employment. This is a setting that could be, a camp setting could be used as a form of daycare. And then we included our language here around that share of cost, looking at income, just to be comprehensive. But this is another option for families where they could choose having daycare, specialized daycare, daycare in the home setting, or finding and securing a camp type setting while the parent is working or going to school. That could lead to employment. And you'll see an update to our language, which is really a good one. It reflects that for families that are working inside the home and also outside, because we know that we have individuals who work from home, especially now with the pandemic, but even prior, it's just clear to everybody that daycare is applicable to individuals, families, parents, caregivers working, regardless if it's in the home or outside of the home. And that's where the service coordinator will do program planning to make sure that that objective is being met, that parents can work while their child is being attended to, or their adult child, as potentially for a camp setting for a form of daycare. So that's the second family support that we are able to offer. And the next slide, social recreation. We're going to talk more about social rec, because social rec, there's different components and needs behind social recreation. But the very first one I want to cover with you is around social recreation as a form of family support. When we say family support, that means that the family, the parent or caregiver gets relief or a break from the care and supervision. And one of the ways a family could do that is by choosing a social recreation activity in the community that we're going to talk about. It's a service code 525, which is how we identify social recreation. But in terms of program planning, when a family, a parent or caregiver states that they need a break, that they need some relief, they want to, they need some time to their self, or they need some sort of activity for their child to make sure that somebody's providing that care and supervision. a social recreation activity could meet those needs potentially. And I see there's a thing on the screen here. I think the team will get that removed here just in a moment. Thank you so much. So that's the other one when we talk about social recreation. I'm going to go over it as when we talk about skills and practicing skills. But first, I want everyone to be aware that it is another option for a family support that we haven't been able to offer for the past couple of years for this type of relief. So we can consider those social rec activities. The next one, non-medical therapies as a family support. Traditionally, non-medical therapies by themselves, when we talk about art therapy, dance therapy, music therapy, typically are prohibited at regional centers in terms of clinical therapy or treatment. And that's still the case. That's how the Lanterman Act is still set up today, that it's an exemption. We are prohibited from purchasing. The term that's used is experimental treatments, that we can't purchase those services when it's for treatment or for clinical purposes, like physical therapy. However, we wanted to make sure that these services are inclusive as possible, and we cannot authorize as a form of clinical therapy or treatment. We're still prohibited, but we found a way of looking at this through a lens around as a family support. So when you look at a non-medical therapy, art therapy, dance therapy, music therapy, recreation therapists, specialized programs, that's really no different in some ways than a social rec program. There's a lot of overlap there. And so when we are able to authorize a social recreation program for family support, we're able to look at it from a non-medical therapy also as a form of family support. So if an individual identifies a non-medical therapy as the means for that family to get relief from the care and supervision, that is an option for families, which is different, and why program planning is so important in that process to understand what the need and the objective is to really do good program planning. Because if the need and the outcome is for treatment or physical therapy, while some people do use these to get there, we have to find and explore alternatives, then work with the families to figure out what, how we can meet those needs. But for the community here, really important, very exciting, I think, is that we can offer non-medical therapies as a form of family support. So we're going to be looking for providers and vendors that specialize in these different areas, and then offer that for art therapy, dance therapy, music therapy, equestrian therapy comes up as well, to be able to authorize. But that's what is another layer of a family support service that'll be available to our community. This slide is in here just as a quick reminder for everybody that as we're looking at those services and these new additions, new options for families, for family supports, the team needs to work really closely with the families and the consumers to identify those support needs that are going to be needed. So when we're looking at camp settings, social rec settings, non-medical therapies, we have to make sure that the individual, depending on their needs, have the supports that they need to be successful at that program. And we also have to ensure health and safety. So if somebody has medical or nursing needs, we have to do a level of care to ensure that we have the proper staff, potentially at LVN or registered nurse level, or maybe the individual needs behavioral support to be successful in these activities. The team would work really closely with our behavioral team to identify those behavioral supports, or maybe there's no medical needs or no behavioral support needs. And so they refer to that as non-medical. But it's just a reminder that anytime we're looking at a family support service, this is the next really important thing to make sure that we are putting in the proper supports, so the individuals in these programs can be served and be supported in those programs. So just a quick reminder on level of care and the importance of meeting the needs here. Okay, so I got us through our family support services, these new additions. The next part of our policy we're going to look at is still social rec. We're going to start with social recreation. I started today talking about how we can look at this from a family support perspective. Care and relief, YMCA is the example I'm going to use today. Using a YMCA, that's the example, letting individuals, a child, go to this program so the family member gets relief. That's what we talked about earlier. They get a break, the child goes to the program. What I'm going to talk about next is when there's skill acquisition, when there are skills being taught, when there are skills being learned, when there's skills being practiced. This is a different kind of outcome, different objective. So the objective isn't to get the family member a break. The objective is to teach something to the child, to increase relationships, to increase those peer interactions, the greetings, shaking hands, waving, taking turns, sharing, engaging in group activities, social interactions. And so the spirit behind this policy is to look, and there's some language up here, but really looking at individuals that can benefit from social recreation skills and the importance of IPP planning. And you'll see some slides coming up about what that looks like. But it's our duty as a regional center to make sure that we are advocating for individuals to get these services, looking to see if there's anything in the community that exists, because we still got those generic and community resources that are responsible. And in addition to those, regional centers have the authority and ability to be able to authorize and support individuals, regardless of their behaviors or their physical conditions, that we find programs that can meet the needs. And that's really important when we are working with our vendors, our service providers, that they demonstrate that they can meet the needs of our inclusive entire community, because our goal and our values on behalf of North LA is that everybody's entitled to a social rec program. Everybody's entitled to camp non-medical therapies, regardless of their disability. And so that's where those level of supports are so important. And you'll see let's go to the next slide. I think it'll highlight it. When we're talking about social rec, socialization, there's definitions in our policy that I think are really important, that we're using the same language, because depending on the field and different perspectives, we have our idea around socialization and what that means. But in terms of our policy, when we're authorizing social recreation for either learning or practicing skills, you'll see here on the slide that the definition are really, when we talk about social rec, activities that are designed to enhance the development of social skills for children who may have social skill challenges, which limit those opportunities in the community, or for adults in maintaining friendships. And so if there's a deficit or an opportunity to improve on communication skills and interactions, and the team has identified that with the family, with the individual, and there's goals, this could be one of the avenues to consider to help support and facilitate that learning and that enhancement of skills. So it's very skill focused. There's things being learned and areas being taught when we talk about social recreation. And social skills, another definition, abilities and behaviors that are needed to initiate, plan, explore, and participate in age-appropriate social relationships and activities. When we talk about being inclusive in an inclusive community, part of that is relationships, being involved in the community, having friends, having peers, neighbors, not just paid staff supporting individuals, but really true, genuine relationships at work, at school, at the library. And individuals can benefit from this type of service that we can offer to enhance and to learn and to practice skills that they need improvement, or to further enhance to get them to their goals or what they're trying to achieve. So very specific definitions that's available. And I think there's two more coming up on slide 11. excuse me. Social skill challenges. So individuals in social recreation programs that are designed to enhance skills or to improve those opportunities where there's areas that are needed could include, these are just some examples, if individuals are shy or passive, limited responses if somebody's engaging in a social interaction and there's not too much response, if there's inappropriate social interactions, teasing, bullying, excessive friendly advances towards others, that social distance, if that's a challenge, social cues, understanding those social cues, and if there's difficulties in developing friendships and other behaviors. These areas are really important because this is what the team is going to be focusing on and working and supporting our families and individuals we serve. Because if we're going to put somebody in a social rec program, we want to make sure that those challenges are being addressed. And we need to know what those challenges are because we got to make sure that it's effective and we got to make sure those individuals are improving in those skills. Because if there's not improvement occurring or those goals aren't being met, then we need to come up with a new plan or a different plan or recalibrate. So this is an important definition when we talk about learning and enhancing. Just some examples of individuals that can really benefit from social rec to really learn and practice those skills. And then we have the last definition here, social rec activities help individuals learn and develop age-appropriate skills. So those developmentally, what are those social skills that should be occurring and developing? And then also looking at activities that provide opportunities and integrated and specialized if needed to engage in hobbies, recreational events, or to pursue leisure interest. And we have a note here that typically individuals access social rec activities via their families, residential services, or day programs. Naturally, when you look at good programming, there's a lot of natural opportunities that occur for social interactions, greetings, if individuals are involved in different after school activities or work or day program. That said, we know that that's just one area. And so what's really important is if an individual is already doing, for example, a social rec activity, we would want to know if there's a different social rec activity, how will that be different? Or how will it support what's currently being taught? Because we want to make sure the goals don't contradict. There's some careful planning that needs to be done. If somebody were in two different types of programs, we would just need to do careful planning about what that would look like and to make sure that we're not duplicating efforts. In addition to if individuals are getting natural interactions or working on these same kind of skills in other areas, we can still look at other social rec programs, and we would have to understand how they would practice or learn or enhance what they're currently doing. So that's why the program planning piece is so important to understand those goals and to also make sure that we're not doing over programming, to let everybody know, because as we get more options and more opportunities, we want to make sure that we're person-centered planning, that we're doing what the individual wants, what they need, and what's going to help them. And so one way to do that is with the program planning and looking at the schedule with individuals about what makes sense for this person and what's going to help them and what are those goals. So just to kind of highlight, as we're talking about learning and practicing, to really focus in on social recreation and at North LA, how we're going to be implementing this at our center. And slide 12. So the slide 12 and 13, it's I think 6 prompts of some assessment questions. And this will be available to everybody. So we want our community to see these questions and we want our staff to have these questions as well. Because these are the areas, if we receive a request for social recreation, because that person or individual needs to increase skills, we have some areas that we're going to be looking at. One, the North LA program planning team has determined that there are challenges and that those challenges are documented in the IPP, or if they're new challenges, they will be documented in the IPP. So we have a record, Because if there's no record in the IPP and there's no services supporting that, then that means we've got to take a look at that and figure out how do we get those needs met and appropriately to get those services. So we got to understand what those challenges are. That way we're doing good planning around getting those objectives met, because we got to make sure it's effective and that those services are working. So that's the first area of consideration. Next, an opportunity has been identified to achieve an improvement in the consumer social, recreational, or leisure life to develop relationships. And that's going to be kind of a given, I think, in a lot of ways, where we think about if there's an interaction or a social rec program being considered, how will it improve the individual's life? Because that'll be part of the program planning that will help support why that service is needed in the IPP. So that's another area that we should all be thinking about, is how is this going to lead to an improvement in this area for social, recreational, or leisure life that can help enhance those relationships. Number 3, really important. The determination shall be made based on the needs and preferences of the individual. True person-centered planning, or when appropriate, the individual's families or advocates or caregivers, and shall include a range of service options proposed by the program planning team. So this is where the team will be looking at, are there community resources already doing this? Is there a generic resource available? Is there a program that's going to make more sense for this individual? And that's where that discussion and that planning occurs, and really not losing sight of person-centered planning, which is in there. And the department was clear about that as well in their memo about the needs and preferences of individuals in this process. So for families, if you're aware of programs that meet these needs, please talk with your service coordinator. Service coordinators will also be talking with you about options and planning that we're aware of, partnering with our Family Focused Resource Center, our community-based organizations, putting together of all the programs that we know that exist or that we need to build for through the vendorization process, which will be coming up a little bit later. So these are the first 3 areas that we're going to be looking at that's consistent with the policy. This is all driven from policy. And then the last 3 on here is that the services that we're selecting have to be effective. They have to work. They got to be making a difference. And of those services identified, then we look at cost effective. So the area we always have to look at is what is effective, and then we look at cost effective. So we look at what is the need of the individual, will this program meet the needs? And if there's different programs that can do that, then that's where we have to look at cost effectiveness. So effectiveness before cost effectiveness is what is being highlighted here. And then we're required by law to look at any generic public or private resources that will be effective in achieving the IPP outcome before we expend funds. So if families are aware, if you're aware of programs in the community, we can help advocate and do advocacy with those entities that should be providing those services already, or providing supplemental staff for the individual to go to that program, or our ability to be able to expend the funds through the services that we offer with this restoration for camp social rec and non-medical therapies. And then we see the last one here where we, when we're assessing new ideas or new programs, new supports, the team will be looking at all the current services and supports that are in place. And before we put in additional social recreation, additional activities, we have to see how those goals and objectives will be supported. Kind of what I mentioned earlier, we just want to make sure that they're not being duplicated or that they contradict each other, which could happen when you start getting multiple services doing similar work. That said, we want to find areas where we can support this. And so we'll be looking very carefully if there are skills being learned in one area, in one program, and we may identify, or you may identify another program where those can be practiced and those can be enhanced, which is really important for the program planning process. So just kind of a brief abbreviated version, we want our community to see the areas that we have to meet, the department's expecting for us to meet within our policy of how we make those decisions. And then the IPP outcome. Most important piece, and this is where person-centered planning is so critical, that when we identify a outcome, when we agree that we're going to do camp social rec or non-medical therapies, right now we're talking about social recreation, we have to understand what that deficit is or what that improvement will be. And so I threw an example here using myself, but I will participate, for example, will participate in YMCA social rec program 2 days per week to enhance social skills, greeting peers, and will join group activities to practice sharing items. Just an example about how understanding why we need this program or why we need this support and what will be achieved is so critical, and why that relationship is so important, working with the service coordinator to really identify not just social rec just to go and be social, but what are we trying to address? What's that deficit that we want to improve, or what's the area of improvement that we want to see, and how do we measure that? How do we measure that there's progress there? So just an example of that IPP outcome and how those, when we're asking questions, when we're trying to assess, that assessment process is really leading us to do a really good IPP outcome for the individual. So when we do our meetings and do follow-up, we can say, hey, is this working? Do you notice a difference? Do we need to look at something else? Do we need to look at a little bit more? Or do we need to look at something different? So really, really critical for looking at the goals and objectives, which allow us to authorize services. Okay. Slide 15, very similar to what I just went over, but you'll see the different term non-medical therapies. You'll see non-medical therapies, which include equine therapy, music therapy, dance therapy, art therapy, and specialized rec, can also be opportunities to provide social skill development. So if there's a dance class, some music therapies, some are more individualized, some are more interactive. Equine therapy, if there is a program or a proposed program that could offer some of these services that could enhance social skill development or relationships in the community, we are able to authorize that as well. So it'd be non-medical therapies for learning and practicing skills. And we're going to be seeking vendors and service providers to do this kind of work. But the outcome, again, is so important, because I started the presentation today talking about non-medical therapies as family support, which could be one option that makes sense for a family to get that relief and a break. This is very different. This is non-medical therapies when the goal and the outcome is specific to enhancing a social skill. And the same kind of process that that we just reviewed, you'll see in the following slides, that if we get a request for a non-medical therapy that for the purposes of social skill development or enhancement to practice or learn skills, you'll see on slide 16 and 17, the same thing I just read from the other two, same format, same questions, same assessment that will be used to ensure that we're being effective and that we're really getting an IPP outcome that's going to benefit the individual. And the next slide. So I got us through the services, and what we're going to focus on next is I'm explaining the services and how we authorize them. The biggest question, the most important question, is how do we get this, and how do we get this now? And I want to do a little intro kind of around the steps that we've been doing. So our community services department has been working very hard behind the scenes to engage individuals who used to do this work with us many years ago to see if they have an interest in doing this again. And there's interest, which is good. They've also been reaching out to other regional centers to figuring out what type of programs have they vendored, because we want to partner with them as well. We want as many options for families as possible. One of the challenges is because our service standards just got approved on March 23rd, we've been able to, now that we know that we're approved, now we can do more even active work to be very specific with providers about what we are needing. Because if, for example, if the department didn't approve our policies, then we would be doing vendorizations for things that we can't do. And so now we know what we can do. We have our policies, and now it's allowing community services to do all of their great work on their end to get as many providers as we can for these areas. And so we're working on that. We currently do not have any vendors yet. We are in the vendorization process. And I'm going to let Maria talk about the vendorization process. And then I'm going to touch upon some things that we can do now in the meantime to start looking at these services that are really important. So I'm going to give it to you, Maria, and then I'll come back after you.
Thank you, Dr. Weller. Hello, everyone. My name is Maria Hernandez. I'm a resource developer in the Community Services Department here at North LA County Regional Center. Like Dr. Weller mentioned, we are actively seeking service providers to be vendored for social rec, camp, and non-medical therapies. For the request for vendorization, the process to date, NLACRC has identified and reached out to 27 former providers to request that they enter into development for social rec services. In March 2022, NLACRC's social rec service standards were approved by DDS. In April of 2022, NLACRC published the request for vendorization for social rec services on our website. And as of today, NLACRC is actively engaging community partners to vendor services. Next slide, please. So the type of services that community services is seeking to vendor are camping services. This is like a day camp, meaning not overnight, traveling camps like camping trips, residential camps, equestrian services, therapy through past credentialed equestrian programs. It could be mounted or non-mounted. Recreation services like LA Parks and Rec, YMCA, Special Olympics, and classes in non-medical therapies like dance, art, and music. So our current published projects are up on our website. We have 9 separate projects on our website, hoping to acquire multiple vendors for each project in multiple languages and in all 3 valleys, San Fernando Valley, Santa Clarita Valley, and Palmdale. Each project here, as you can see, has a hyperlink that has an overview, qualifications, more information on each project. Resource Development will be hosting an applicants conference for interested service providers on Wednesday, May 11th at 2 p.m. This applicants conference is a meeting that Community Services sets up to provide further information for those interested to provide services for our community. And if you'd like more information, you can please visit our website and click on how to become a service provider tab for the social recreation request for vendorization announcement. NLACRC recognizes how important social recreation camp and non-medical therapies are to our community. Therefore, we will do the following while we seek vendors. Number 1, we will utilize existing service providers in other nearby regional center areas known as out-of-area providers. And number 2, we can approve parental reimbursement for services that are approved through IPP planning for NLACRC to reimburse the parents. And I'll go ahead and pass it to Dr. Weller.
Thank you, Maria. Can we go back to the previous slide real quickly? Thank you so much. And then I haven't checked the chat yet. I'm going to come to that, but if somebody can put the link, maybe it's already in there from the website, just in case there's anybody here in the audience that is interested in wanting to become a vendor, which we hope there's some individuals out here, that you can get connected to the website and see the specifics and the links there as well. So we'll just so everybody has that from the community. And then what we're trying to do here is to navigate, because it's so important to us to be able to get these services out. Our community services department is very committed to a high priority to get these individuals, who's ever interested, through that vendorization process. There's many steps involved, but the team is looking at how to do a streamlined track with what we can do to get those services going. And in the meantime, looking at out of areas, we're going to put together a list. We're still collecting information now You might be aware of some other programs out there that if they're already vendored at other regional centers, we want to use them. And if they're willing to serve North LA catchment area, we'll talk to them. So that is one avenue that we can do now. And the other, when we talk about parental reimbursement, it's a process that North LA has that allows, if there's agreement in the IPP, has to be planned and agreed to, that a parent potentially could pay, and then they get reimbursed going through the process with us from the regional center for reimbursement. But I want to recognize that sometimes that's a hardship, because that's, for some families, we know that can be challenging to put money up front to be able to do that. So we don't have any other guidance from the department at this time to do anything differently, but it is, it's not a perfect solution, but it is another solution that could work for some families, just as we're trying to navigate in the meantime until we get our service providers here, and know that once we get our service providers, we're going to be announcing that to our community and promoting it, that we have these services available for social rec camp and non-medical therapies. But we're trying to be as flexible with what we can and rely on things that if there's any way we can do it now, these are some options that we could do out of areas, and also the parental reimbursement process. And so we'll go through that as well. And then in addition to our service standards and our policies, every regional center is was required to submit an outreach plan. And this is an indicator of how important these services are to our community, across all communities throughout the state. And for North LA, we've identified different areas that we are actively doing or will be doing shortly to get this information out. Because I see 127 participants, which is a large town hall here, but we serve between 28 to 30,000 individuals. And we want to make sure that everybody knows about these services. And so the expectation is to develop a plan providing information to service coordinators, because they're going to be working so closely with families, making sure that these services are discussed at program planning meetings, conducting outreach to individuals, served families, providers, local community organizations to help facilitate awareness, and looking at outreach efforts that should extend to individuals and families who may not typically use other services. So we're looking at ways that if there's families that aren't utilizing or accessing respite or personal assistance, doing targeted outreach to see if maybe these services might be a better fit for the family, might be more accepted by the family for a camp or a social rec program, for example. And lots of emphasis, I will say, for making sure we're getting this information out in multiple languages and doing outreach for non-English speaking individuals in multicultural communities, making sure this information is going everywhere in our very diverse catchment area that we serve for individuals. So just sharing our outreach plan, and let me see if there's anything in there. You'll see us promoting news you can use, our social media, utilizing Peach Jar for the school districts of announcing social rec camp and non-medical therapies, looking at local grassroots, getting physical information out on this topic to our community, training for staff, community awareness and promotion. This town hall is one example of one of the beginning stages of getting information out to our community, and then looking at updating our website with our policies and our assessment tools. So all of this information will be available and transparent to our community and available. So we'll be uploading that as well and sending it out, news you can use, which is our next steps. The team's walking me through the next slide here. Sharing this PowerPoint in English and in Spanish on our website, our service standards, the new revised service standards, which were adopted by our board, approved by the department, will be in English and Spanish on our website. And then we're also the teams either uploaded or uploading those tools so families can actually see our assessment tool. And you got to pretty much see it here in the PowerPoint, but it'll be the actual tool of how we make those decisions, because we want our community to see how we're making those decisions. So we're looking at the same information, really important for transparency, and that we're utilizing the same information. And I think this is where we move into questions Q&A. I know that was a lot of information. Know that we are committed and we value social rec camp and non-medical therapies. We're excited that we have this option. We've been hearing about it from our community for quite some time of how important these are. So the fact that it got traction to be able to get restored is a compliment that many of you probably hear your voices have been heard. So we're excited to do this, and we're building, and we're going to continue to get information out to our community as we receive it. As we get new vendors, we will promote. As we get more guidance from the department, we will provide that information. And then we're going to continue to partner with you as we find ways to implement while we're doing our vendorization process. And so please, if you know of programs, if you have ideas that meets the criteria we talked about today, talk about it with your service coordinator. That way we can start the planning process today and start talking about those services. All right, I'm going to turn it over to Q&A. And let's see here. And individuals can also raise their hands too if you would like to talk. We can do both. Okay. Does somebody want to read the question that I can answer? Or I can do both, whatever. I'm flexible.
Jesse, would you like me to read them?
Okay.
Okay, let's start with the first question. It says, I know regional centers are now offering camp and recreation services, but many camps left are still open. Camps and social recreation have been cut from our system since 2009. That is a long time for camps to be closed, and some closed for good. How many vendors are there for camps, social recreation, and non-medical therapies?
Right.
There's another comment, but the question I think ultimately is, how many vendors do we currently have for camp, social recreation, and non-medical therapies?
Right now we have no active vendors with the camp, social rec, or non-medical therapy service code at the moment. So there's none. There's an interest of 27 before this town hall. Hopefully it's growing. So we have a great interest to get vendored. And that's part of the reason why we're really looking at that parental reimbursement or out of areas. So what we don't want is for families to have to wait any longer. So we're trying to find that balance of what we can do that's supported. And then also lots of efforts to get individuals vendored for this service. But the answer right now is that we don't have any active providers under that service codes.
Right. The next question, there's some really good feedback that we'll take here regarding the presentation. And the question is, how did camps work before 2009 when they were cut? Now, I'll give some help there because that was prior to you joining the regional center, Jesse. So camping was authorized as a family support service back in 2009. And so that is how, when the assessment was, when the service coordinator assessed, it was based on camping services being able to meet a family support need. And I'll give an example. For some camps, especially overnight camps that had specified dates, that was an opportunity for families to schedule vacations where they would have a guaranteed service where the individual could go and receive care and supervision based on their individualized needs, and the family would be able to plan some family time away. And so that was a very common way that camping was authorized prior to 2009. All right. And there's one more part to this question, and it says, is there a before and after measure regarding how much people improve on social skills? And yes, so that would be part of the program plan. So the service provider that would provide the social skills training would develop, would assess, evaluate an individual's social skills prior to beginning services. And then part of the plan would be to provide the social skills training, and then also that social recreational service that provides the opportunity for skill acquisition. And so those two together would be our plan to help an individual develop certain, whatever social skills are identified through the assessment process. And so typically the service provider would then assess how much progress an individual is making at the 3-month mark or possibly at the 6-month mark. So yes, there would be assessment both before and after to help the program planning team understand the progress being made. All right. Okay, I'll read another one. The next question. If our child is on track for self-determination, can they also receive these services? Oh, Jesse, you're on.
Sorry, everybody. Crisis call aborted. Okay, the question one more time, Ruth.
Is if someone is on track for self-determination, may they also receive social recreation services?
Yes, everybody's entitled to all the services. When you get into self-determination, once you have that signed spending plan, the approved SDP, IPP, then that individual is in self-determination. And there's also similar services available in self-determination. The codes are a little different, but you're not excluded or precluded from getting services leading up to implementation in those. And in fact, I would just change the question about how will the services that we offer here, what will that look like in self-determination? How do we build that there? And that's where the specialists in the team will help you navigate that for self-determination.
Okay, next question. For parental reimbursement, will it have to be with a camp that has applied to become a vendor?
No, not necessarily. So our goal is to have our service providers and our vendors, and there's a lot of reasons for that. One is for quality assurance. The other is for ease. It's so easy to put in our purchase of service and to get that service authorized, even same day. When we do out of areas and when we do parental reimbursement, those are just so many processes involved. And so the service provider is what we're really trying to find. In the meantime, if families are finding their own programs, service coordinators are identifying community programs, they do not have to be an active vendor at this time for the 024 process for parental reimbursement. But we do want to talk to them that if there is an interest, we do want them to become vendored. So they do not have to be an active vendor at this time. And that's because we don't have the vendors and we don't want people to wait for this service if we can offer it.
Thank you, Jesse. So the next question is, oh, let me get some help to have this translated into English from Spanish. Anna Maria or?
I can translate.
Okay.
Maria.
It just means if the kids are qualifying for camp and they need the assistance of a PA, will the PA be able to be there in the camp with them?
We offer one-to-one. So if an individual needs a camp social rec or non-medical therapies and their support needs are require or need an additional support, we do that. We do it now, and that won't be taken away just because we can authorize the service. So it's just that program planning piece. Now we can do the service, and if they need that one-to-one, we can implement and put that in place as well to support them at the program.
Okay, next question. Once my child gets authorized for these recreational services through traditional regional center services, can the services be continued after we transition to the self-determination program?
Yes. So with the self-determination process, what the team will be looking at is the current services and supports that are in place in traditional, and then doing program planning, a new IPP plan about how to get those same goals and objectives met. And so the team will work with you to identify what that service is, who the provider will be. So it gives you a little bit more flexibility there in terms of that, those options, but it's not restricted. So the team just needs to understand what's currently in place, and then work through person-centered planning with the families to identify utilizing self-determination. Has their own codes. They're a little different, but the same themes are still there for community integration and inclusion and programming. So the team will work with that to support that, not to take away, but to support.
Okay, and Jesse, I just saw a message that we have some hands up, and it looks like probably the timing is about similar, because the next question was at 2:19. So how about if we take a live question?
Okay.
And that would be Letty.
Letty, you can go ahead and unmute.
Thank you. Good afternoon, everyone. I wanted to verify if these services are available for adults as well as children. Great. And also, we know that for adults, the lack of socialization can cause depression in our adult consumers. And if I have a relatively social adult consumer, and I want to put him in a social rec program so he can continue to be social and work on those socialization skills, how will he be assessed in that measure for success? If he's either staying at the same level because he's already social, how will he be assessed? How is the development of relationships measured, I guess, is my question, if you have a fairly social adult consumer already. And the second part of that is when you were talking about generic and public and private resources that would have to be effective in assisting the individual. Can you give an example of what a generic service might be that could cover that?
Sure. I can take the first part of the question, and I think it's an important one, and why program planning and why that kind of information is so important for our team to be aware of. Because if we know of an individual that has both maybe a developmental disability and a mental health, or a depression, or maybe anxiety, social phobia, people can have multiple things going on. That is good information for the team to know, because that goal might look, for example, could just be showing up to the program. Because if somebody's got depression or if somebody's got anxiety, it's hard to even get to the program. So that might be some of the goals, versus if we didn't have that information or didn't know that information, it might be different, and having those conversations with our specialists and the clinical team. So I think those kinds of information is so critical, so the team can be aware and develop a plan that works for that person, because maybe their goals aren't doing those interactions at that time, hopefully leading to that, but I think it's just part of that program planning piece. Really important. The second piece in there is around, remind me of the question, it'll come back to me.
The generic service
Yes.
that would be utilized? Mm-hmm.
Yes, some of those that we see, well, the issue I think we have is there's a lack of them. We don't have a lot of them, which is why we've had to be able to put in one-to-one supports for individuals to do different activities. But the common example we'll get is like a parks and rec activity, or something in the community that offers a socialization, or that's free on Sundays for people to participate. But the challenge or the feedback we get is that sometimes it doesn't cater to or support those specialized needs. So those are the kind of examples that if we're aware of somewhere in the community that's offering a free program or a cost-effective program. Some cities have requirements to support people with disabilities, but they may not be focusing on our community. So those kind of things, if we're aware of them, we have to look at them. But the feedback we get is that there's such a lack of those already, that this is why the service is so critical. I don't know if the team has other examples, but those are the ones that I hear about the most.
Okay, thank you.
next, do we want the second hand? Rosa?
Rosa, you can unmute yourself. Rosa, you can go ahead and unmute yourself.
Hola, buenas tardes. ¿Hay traducción?
Sí.
Ok. ¿Cómo puede uno saber si la coordinadora de servicio le niega el servicio? Le niega el servicio de respiro, siendo que mi hija tenía respiro regular y después le pasó el respiro acondicionado. ¿Qué puedo hacer en ese caso?
Okay, permítame un momento. She wants to know how can she find out if a CSC denies respite service and now it's conditional respite service. What can she do about that?
Let's see what's going on there. Let's get connected. If we're ever denying a service, you're entitled to, that should be communicated, and then we should be providing a notice of action. You should be getting that in writing around why there's a denial. So if that didn't occur, something happened there, let us know. Let's get your information and let's connect. But the question I think I'm hearing in there is that if respite in the home, or if there was a certain service that you needed or that might work better, this is a chance to do program planning, because now we have more options available for families to look at how they want for respite, for example, family support, how they're going to achieve that. Because now there's options. Families can choose to have it in their home, have a respite in their home. They can do participant directed services and pick that person to provide it. They can choose a setting that we talked about earlier, such as like camp or social rec or non-medical therapy. So the question I think I'm hearing there too is our reassessing for families to make sure that if there was a denial or if there was disagreement, making sure that we're giving all those options to families and reassessing those needs, because things can change for families, circumstances can change. So I hope I'm answering your question, but I do want to get you connected to the team so we could look at your individual situation.
Señora, ¿sí escuchó la traducción en español o quiere que se la traduzca?
No, no escuché nada.
Okay. Dice, si alguna vez se niega algún servicio, se tiene que hacer por escrito. Por favor, denos su información, pero hágalo en... solamente para directamente al Dr. Weller o directamente a mí si gusta, para que no se comprometa su información. Pero dice que ahora hay más opciones para el respiro en casa o con proveedores, campamento o recreación o ocio. Si algún servicio se ha negado es porque ha habido algún cambio, pero si usted tiene alguna pregunta, por favor comuníquese directamente con nosotros para que vean específicamente e individualmente para usted.
Ok, ¿y con quién tengo que hablar? Es que desgraciadamente entré tarde ahorita a la junta, no pude antes, pero no sé con quién me tengo que comunicar, a qué número o con quién. Yo sé que no se puede dar información personal, pero sí me gustaría para poder anotarlo, para con quién me puedo comunicar, porque la verdad mi niña desde el otro centro regional venía con respiro regular y aparte de que me bajaron las horas, me cambiaron a respiro con restricciones, que tengo que estar todo el tiempo en casa.
Okay.
Entonces, pero ¿sí le puede decir eso, por favor?
She wants to know if there is a specific person to whom she can contact because she wants to make sure that her respite is restored. Yes. She's coming from a different regional center, but wants to get information as a contact person.
Okay, let me just assess, see which regional center, and let's get connected. If you can give the team my contact information, and then the team will help me. We'll get connected.
Okay.
And see which regional center and how we can help.
Nosotros le mandamos ahorita la información del Dr. Weller y por un correo privado para que usted no tenga su información comprometida. Okay.
Ah, ok. ¿Ustedes tienen mi correo o cómo sería? Perdón. Disculpe la ignorancia.
No, ahorita le mando un mensaje privado aquí por medio del chat, ¿ok?
Ok, mamita, muchas gracias. Sí,
Por nada.
pero sí, la verdad sí me gustaría hablar con el doctor Weather, que pues que yo sé que también está muy ocupado, ¿verdad? Pero que sí me hiciera un espacio para poder ver ese asunto. Muchas
Okay.
gracias, doctor Weather.
Okay. She says, thank you very much, Dr. Weller, and she's looking forward to speaking to you, even though she acknowledges that you have a very busy schedule.
My name is Rosa, sorry.
Okay, thank you, Rosa.
All right, so the next question, I'm going to switch over to chat. So we have quite a few questions there as well. So first one here in chat, I believe, is how many of the 22 organizations that North LA has contacted are located in the Antelope Valley? So that may be a community services question.
Maria, do you have that data, or we can circle back as well if we need to? I know there's been interest out there, but I don't know the total number.
Yeah, there's been 27, but to know the exact amount for each location, I don't have that information, but I can go ahead and get that for you.
Okay, if you let me know, then I can circle back to ABC and Grow here and let them know as well.
Okay, and another question is, can you explain the reimbursement process when a consumer is transitioning to SDP, and will that be added to their budget?
Gabby, would that help me with this one here? So let's think about that. So if we're adding in a service for parental reimbursement, and if it occurs before self-determination, that family, you would still be entitled to that reimbursement because it occurred in traditional and it was agreed upon. So that would be fine. In regards to having that roll over, if that's part of the program planning, that's what's identified in the need, I would assume that would go into the budget. But Gabby, can you confirm for me?
Sure. And that's correct. If you already have it, we would then add it or include it in your first year budget. If during the first year it's an unmet need, we would add it to your budget.
Okay, thank you. Next question I see here is there an opportunity for training if an organization would like to become a service provider?
I know our community services department offers technical assistance. They really do support providers and questions they have. We do informational sessions. So there's a lot of different platforms. And so what would be helpful, Laura, if you don't mind, is if you can give us an email, if you could tell us kind of what training and what kind of things that would be helpful. We can share that with our team just to give us some idea from your perspective, and then we can see if it's already built into our processes. But if you tell us exactly what it is that you're seeking, it might help us kind of build and take a look at what that might look like. I would say, would that be resource development, Maria, that email?
Yes, I can go ahead and put it on the chat, but it is resource development at NLACRC. Let me go ahead and put that in for you.
Okay, so then we have another from Carla, and it's in Spanish. So could we have that translated? I'm looking for a translator, or I'm sorry, interpreter. The message is at 2:19 p.m.
I'm trying to find it. 1 second. 219
Yeah,
from Carla.
in the chat.
In the chat, okay.
Am I frozen, or is it just?
No, you're not frozen.
Okay.
Sylvia, I just sent you the question.
Okay, while that went to Sylvia, how about if we go to the next? Oh, some of these are their duplications, okay. Can you apply if you're just starting the business and do not have a physical location?
Statute requires us to have a physical location within our catchment area. So that'll be a requirement that we have to have. But if you're interested and need support with that, let's get connected to community services. That way they can support, but it is a requirement. And we get that question quite frequently for remote or even virtual offices, but unfortunately the regulation doesn't allow for that. Hopefully in the future we might see that, but as of right now, we have to have that physical location within the North LA catchment area.
Okay, here's the chat question from Carla. Are recreational therapy service providers focused on the least restrictive environment?
Yes, so when we're looking at vendorization now, we have to be very careful and be very mindful around the final rule, community integration and inclusion. So through the resource development process, they're really looking at, going to work with providers to make sure that we can look at mainstream and inclusive settings that also have supportive elements. For instance, if somebody has medical needs that we talked about or behavioral needs, that they're looking at that. We still can do specialized settings. We can still do that. We can authorize it. But the question and where the state's looking at is how are we building these programs now to make sure we comply with the final rule, which hones in and forces the idea around being community-based and mainstream, or documenting and having some clear rationale if somebody does prefer or require a segregated or more specialized setting. So those are some areas that are being looked at, but that's the focus that we're going to be looking at, is building it in now. So that way our providers are set up to be in compliance with the final rule, and community services will go into a lot more detail. That's their wheelhouse for it, but we're planning for that, for least restrictive and inclusive.
Okay. I'm looking at, okay. Going down the chat. Can you please explain further share of costs for families in regard to camps?
The share of costs would be specific to daycare, for the daycare, and that's based off of that $1 or $2 or $3 share of cost, which equates to overall annual income for a family at for the federal poverty line level, is where that infrastructure comes from to determine if it's a $1, $2, or $3 share of cost. So that's for daycare. In terms of camps, I will need to verify with Vinny, but I believe our FCPP applies to camp settings for camp. So there would be that family cost participation, which we know legislatively is trying to get some traction to get that removed because it creates a barrier for families. But right now that is still applicable, the family cost participation. A little different than that share. It is a share of cost, but the lingo we use for share cost is specific for daycare. Those are the only two fees I can think of. Listen.
And Jesse, I will have to look at the directives from DDS, because family cost participation has been, during the state of emergency, has been suspended. And so regional centers have not been implementing the family cost participation program due to COVID and the state of emergency. And when the directives sunset or expire, then because statute requires regional centers to implement family cost participation, regional centers will once again have to implement the program unless there is traction, as Jesse mentioned, to have the program repealed or sunset in statute. Okay, next question. I'm trying to go back and forth between the Q&A. Are exercise classes that are group lessons count as social recreation? And there's a second part. Does it have to be a typical gym, or can it be exercise classes for kids or adults on the spectrum, such as Zeus Fitness?
We're getting those kinds of questions right now that we're exploring around gyms. And the examples that are coming up is if a gym is used in terms of a social recreational activity, what is that planning that would make it social rec related? Because we know that there's some gyms, just depending on the type of request, that may not have as many social interactions depending on that individual, just depends. Where there are some examples that we're hearing about for individuals that have a plan developed and it's a little more specialized in regards to interacting with other individuals or being in a group setting, taking turns practicing interactions. So it's very specific that really aligns with all the areas we covered in the PowerPoint today. So those are the areas that we're looking at in terms of what does that look like. And so our direction right now is that if the objectives of whatever's being proposed, if it meets the criteria within the assessment and within the PowerPoint, all the stuff that we covered today, if it meets all of those areas, then it would be an acceptable social rec activity, It's the situations where the team would need to explore and to work on and collaborate if an individual is just going to go to the gym and then ride an exercise bike and leave. If that's the plan, the team would need to understand what's that objective and where's the social interactions there. Not saying it's not possible, but we just need to understand that way we're doing a good objective in the IPP, and to also make sure that we're complying with our IPP process, so it doesn't look like we're just authorizing a recreational activity for fun, because that's not the spirit. Is for fun or for leisure. There's skills evolved when we're talking about social recreational settings. So that's what the information we have right now. We might get more guidance from the department as this unfolds. We might get more guidance and we'll provide that, but we're collecting a lot of the different questions that are coming in, different settings. That way we can consult, we can get more information, we can work with other regional centers, see what they're doing. So really good questions, but this is what we're, all the areas that are coming up right now, the specifics. So I hope that answers your question, but this is some of the thinking around that topic in particular.
Okay. All right, next one. Jesse, I think if I go over to, I'm trying to go between question and chat based on time.
I see the next one for, I'm in the Q&A.
Okay, which one are you?
I see, will this impact respite or daycare? For example, will those services be reduced if a family receives social rec services? So I want to get us out of that paradigm. We're not seeking to take away or to reduce. We're looking to do program planning. So if there's a request for camp, social rec, or non-medical therapies that's at the same time as another activity, then then we'll be looking at doing this programming instead of the current programming. But just because you're getting social rec camp or non-medical therapies does not mean you're automatically going to get reduced. It means we have to do program planning to see how does this new programming fit in with the current schedule. So there could be an increase or there could be some decreases, so there's not a duplication at the same time. But I think the language is so careful around it that it really comes back to the needs of the family, what makes sense for the individual. And that's why we do our calendar. It's a one-page, our weekly schedule, to really map things out so we can visually see what's occurring. And that way we're not authorizing, because we got to be careful not authorizing two things at one time. But that's where the planning makes sense. So we're here to support. I think of it as having more options available for the week is the paradigm.
Okay. All right, next up, there's then there's a question in, there's some, so for those attendees that are making recommendations in the chat, please know that we will take those into consideration. So we see some different recommendations here. There's a question here that is in Spanish at 224 for Montserrat.
Sylvia, I just sent you that question.
All right.
Thank you, Jennifer. I'm sorry, let me translate this real quick. Approximately, what is a time that the service must be provided after being requested?
Debbie, do you want to take that one? Or Christina?
Sure. Approximately how much time do we take before the service is requested? I would say we do program planning, and in program planning, we should be able to vet out the need and be able to provide a response, or we would need to reconvene as agreed. But you should receive a response within 15 days from the date of request.
Thank you, Gabby.
Sure.
Okay, there's another question from Marta, I believe Alvarado. And I believe it's asking, are there recreation services for all ages?
There will be. That's what we're trying to build, is for both children and adults. All of our policies have children and adults in there. Our assessment tools have children and adults. So traditionally, I think sometimes the focus goes to children, but these are equally important for adults. So we were very careful and thoughtful on that verbiage. And then when it comes to vendorization with service providers, we're going to be making sure that when they're applying through the process to do these services on their age groups, that they're doing developmentally appropriate services for whatever that looks like for children or for adults. So we're already planning for that aspect as well. But yes, good question. It's for everybody that we serve. There's no restrictions.
And Gabriela Romero would like to ask a question. So she says when it's her turn, she wants to ask her question.
Gabriela Romero, ¿puede activar su micrófono?
Sí, buenas tardes. Mi nombre es Gabriela Romero. Tengo 3 preguntitas cortas. La primera es, permítanme, la tenía aquí a la mano. Bueno, sigo con la segunda. Permítame, no, esta es la más importante para mí. Aquí está. El 1 de julio hay 4 servicios que ya el centro regional va a poder proveer, pero el tercero, yo no escuché nada al respecto donde dice servicios educativos para niños de 3 a 17 años de edad. No miren nada en la presentación.
Okay, she says that she has 3 questions, but the first one is that she saw that as of the 1st of July, there are 4 services that the regional centers can provide. But one of the
Sí, yo le escucho muy bien en el canal de español. ¿Usted me escucha?
le están traduciendo, señora, permítame. Un momentito, por
Gracias.
favor. She saw that all 3 of them, but there was one that she did not see, which is services for children 3 to 17, which are recreational services, and she did not see that on the website.
Dr. Weller, is actually about educational services, educational related services.
We have those. And those policies have been, they're on our website too. And there's the same process that we would always do, that the school district is responsible for those services. And then the same processes are in place today, that in the event that the school district doesn't cover, we assess, then go through that process for an exemption process. So we still have those same processes in place.
Okay.
For.
Ok. La segunda es el doctor Weller. En la interpretación, yo escuché mucho que dijo la palabra un servicio que sea efectivo, demostrar que sea efectivo. Nosotros como padres hemos tenido que tomar servicios y pagarlos cuando antes el centro regional no los podía proporcionar, pero cuando los pedimos dicen que esos servicios nunca los han brindado el centro regional. Mi pregunta es, como dice el doctor Weller, si el servicio es muy efectivo y lo pueden comprobar especialistas, lo podemos comprobar con un IP, pueden hacer servicios únicos? Esa es mi pregunta.
Un momentito. Okay, she says, Dr. Weller, I heard that you use the term effective services. We have had to pay services as parents. We have had to pay for services before when we ask, but when we ask for them, we are told that they are not approved unless they are approved by a psychologist or another professional. Can there be unique services approved for our
¿Me escucha?
consumer?
Oh, perdón. Ok, gracias. Sí.
We'll need to get some more
Ok,
information.
nomás me falta la última. Gracias, le agradezco.
We need to get some more information there, Gabriela. So let's connect with the team here so we can figure out those actual services. The ones we're talking about today are very specific. So if there's a need or a support need related to camp, social record, non-medical therapies,
Ok.
we'll need to know.
En un IP, yo tengo documentado donde mi coordinador miró que ese servicio le hizo muy bien a mi hijo y también la psicóloga, servicio de delfines.
¿Puede repetir eso, por favor? Señora Romero.
Oh. Ok, el servicio ese que yo le digo es de delfines, de terapia de delfines.
She's talking specifically about a documented IP service for dolphin
Y está escrito
services.
en un IP,
And it's
en un
IP.
IPP, y también la psicóloga, los resultados muy efectivos. El doctor Weller utilizó mucho esa palabra.
It is an IPP and it has been very effective, and that is a term that Dr. Weller has used.
I think we need to get more information if we can. I would love the opportunity, Gabrielle, if we get you connected with the team so we can unpack this a little bit and then see what those needs are and what those requests are. That would be helpful so that way we can help guide the situation and the next steps.
Ok, y la última pregunta, como padre, estamos en esa situación muchos padres. Ya hicimos el proceso que nos dijeron, ya lo pedimos como se debe de pedir en una IPP, con la supervisora presente, y yo pedí los servicios equinos como terapia, no como recreacional, como una necesidad, y ahí lo demostramos. Los pedí el 10 de noviembre, me contestaron el 19 de noviembre que se están revisando el equipo. En un futuro cercano ya tendremos la oportunidad de ofrecer los servicios como este. Estamos después de 5 meses y a mí no me han contactado, y mi pregunta es, muchos padres estamos en esa situación donde ya los pedimos, donde ya le entregamos la información al centro regional, ya dimos datos, teléfonos, servicios, y lamentablemente no nos están informando, y lamentablemente nosotros como padres estamos teniendo que pagar esos servicios.
This is her last question. She says, as parents, we have been.
¿Qué es lo que debo de hacer ya?
We have gone through the IPP process with a supervisor present. I have asked for equine services as therapy, and I put my request on November 10th. I received a response on November 19, which said that it was being reviewed. It's been over 5 months and I've had no further contact. We as parents have supplied all the required information that we were asked for, and we are still paying for these services.
Good point, Gabrielle. Thank you for sharing. I think it's good information, and two, it's really highlighting the importance of reassessing and then also responding to this need, because we can offer these. We have our assessment tools. We have our different options that we're exploring until we get our vendors in place. So the team, I know the leadership team is here. They're going to get connected with you, Gabriela, and they're going to address your current request, and then also any other questions that you may have. We'll get connected.
Okay, and the next question I'm going to go to is,
Sí,
oh, I'm sorry. Oh, okay. I think they're getting connected. Okay, so next question is regarding reimbursement and if reimbursement is effective as of today. It says my son has been attending music therapy for the last 2 months. That one is interesting. So Jesse, do you want me?
Yeah, I would just only point I was going to bring up is getting consultation around this topic, given the fact that our service standards were just formally approved by DDS. Until our standards are approved, we don't have the statutory authority in that regard, I would think, to do retroactive, but I hear the importance behind it. So I think we just need consultation.
Well, and I think actually what it's asking is if it could be funded or reimbursed for the parent as of currently, now that I think what I'm understanding now that the service standard has been approved and we're implementing the service standard. Anyhow, in either circumstance, important to get in touch with your service coordinator to discuss the request. Okay. And just one note there, and that is, just in terms of reimbursements for services in general, any services that we purchased, we typically that's through the program planning process. And so there are very few instances where we do retroactive reimbursement because there's agreement about those services that will be purchased in advance by the planning team. Now, I know that we're using the term parental reimbursement under a particular service code as one of our mechanisms for being able to fund these services while we go through the vendorization process. So there are two different things there. Anyhow, in either circumstance, very important to talk to your service coordinator, about any service that you're purchasing and any service that you want for consideration for regional center funding. Okay, the next one here is non-medical transportation from or to location a service covered by the regional center? Non-medical transportation. So talking about transportation that is typically funded by regional centers, it's typically specialized transportation that is coordinated to support an individual in participating in particular programs. So when we think about non-medical transportation, I wonder if that's just typical public transportation, or is the request for I'm trying to think the types of transportation available, or is it, I'm sorry, the thought was mileage reimbursement. Is that what the request is related to? I can tell you when it comes to typical public transportation, because regional centers, the definition of the services that we may fund is specialized, so funding specialized services. It is not common for a regional center to fund for public transportation, transportation that's used by the community in general. Similarly, in terms of purchasing vehicles or supplementing the cost of vehicles, it's not something that a regional center can do. I do know that there's mileage reimbursement that's associated with the provision of respite services. So respite providers, as part of their service delivery, are funded for both the service and mileage to deliver that particular service. I can also share with you that in areas where we have a challenge in having providers serve a particular area, and that tends to happen in our more rural areas, we have sought the approval of the department to fund things like mileage and higher rates specific for providers to serve a specific area. And the most current service that we're doing that is early intervention services in the Antelope Valley area. Whereas a regional center, we have really, it has been very challenging to secure enough early intervention services in the Antelope Valley to meet all of the needs of the individuals that we have living in that area. And so when we find that there's an area that we are having challenges serving, we do have mechanisms to seek approval from the Department of Developmental Services to be able to increase rates and or add mileage costs so that we can encourage services to be delivered to that area. But we do have to go through a very specific proposal and process and receive approval from the Department of Developmental Services before we're able to do that. Though I will say we were successful recently with our infant development program and our proposal there. Okay, the next question. Actually, could we go to Janet? She has her hand raised.
Janet, you can go ahead and unmute.
Hi, everyone. You actually answered my question, but I was talking about not specifically reimbursement, but I want, like I said, my son's been going to music therapy, so I just want to know if from today on, can I get that covered since I'm already with a vendor for music therapy?
You would make that request to your service coordinator. So it does need to go through the program planning process. And then you're, going through that planning process based upon agreement, the regional center would then be able to authorize funding. So I would suggest that you contact your service coordinator, very promptly, and you may already have done so. And
I did.
Okay. And then,
I did. I just wanted to make sure if this was effective as of today.
Yes.
Pending proper approval, of course.
Yes.
Right.
Going through that planning process.
Yeah. Okay. Thank you.
Thank you, Janet. Okay, I am trying to, and I don't know if, okay, I think we have some questions over now. I'm going to switch over to the Q&A portion and try and pick up there based on time. Okay, so at 2:26, it says I have a younger child that would really benefit from organization group classes like My Gym or Gym Marie's, such as art and music that offers great socialization and communications with neurotypical peers. I would prefer the parental reimbursement in these cases because unless the regional center speaks with them, I don't think these franchise owners want to be registered vendors. I also don't want to be forced to share my child's health information with them to convince them to become vendors. What are the criteria for parent reimbursement and how will it be different than the current vendorization process or the current vendor process? Will we submit receipts to the financial management service or the FMS? I believe it would be through the financial management service and
first
for the
possibly. I need to double check with Evelyn just to make sure, because what we'll need from the parent, if we're doing the parental reimbursement, would be through the proof of payment. That payment was made for that service, and then we have our internal steps we follow to reimburse the parent directly. So I don't know if FMS would be involved there. I'll double check just to make sure. Very different than the vendorization process, where you actually go through the entire vendorization process, get a vendor number, have to demonstrate all of the requirements to have the business and the insurance coverage, and that whole process, which can be lengthy. There's many steps involved. So there's differences between them, but the 024 process for now does offer that flexibility, and you wouldn't have to disclose those things to us around the health, we would have that through the IPP planning process. It would be more based on proof of payment and those agreement in the IPP demonstrating that service. So.
Thank you, Jesse. Okay, there's a question here from ABC and Grow, although I think that we may have answered it through the discussion of the 637 proposal process, where when we do find that a vendor that we are having challenges with securing vendors to serve a particular area, we can go through a process to add incentives for vendors to serve that area, such as mileage reimbursement or higher rates. Okay, I think the next question there is, says many camps are truly inclusive, do not want or need to go through the vendorization process. How can a family access inclusive resources if you're asking them to go through the lengthy process of vendorization? Many fill up the same day they open for registration. Oh, I think Dr. Weller just did share that they're two separate processes. So parent vendorization is a much shorter process, much more streamlined than the vendorization process for a service provider like a camp. So I hope that clarifies there. And meaning to say that, and also let me share another, which is I know can be an issue in the community, and that is that typically payment is in arrears. So families will pay for a service. If there's agreement that there will be parental reimbursement, then they would submit proof of payment and the regional center would reimburse for that service. And so while a parent is going through that vendorization process, or if I would like to, I'm not sure if we can do it, but I explore the use of a financial management service, because then there would be no impact on a parent in that circumstance, because the FMS would pay for the service, handle the payment and the documentation, etc. But that would be, so the parent would become vendored and then would be able to submit the billing, and a much shorter process versus a provider that has to go through quite a number of steps to become vendor in terms of submitting a program design and documentation, etc. Next, actually, I'm going to ask if someone can take over looking at or reading questions. So one of our support, because I want to look up FMS while we continue to go through this process.
Ruth, I can support you with that if you'd like.
Fantastic. If you'll do that, it'll give me a chance to take a look at a few things.
Great. I'm going to go back to the chat, if that's okay with everyone. And we are going to go, let's see. I'm looking for the next question. Okay, question. Can you apply if you are just starting the business and do not have a physical location?
We did that one.
Oh, sorry about that.
No worries. We did that. And the answer is you need to have the physical location.
Okay, what about, did we do, will this impact respite or daycare services?
I think we covered that one as well, and that's the program planning around what are the needs of the individual now that we have more options available, and what does that individual need. So that's just program planning.
Great. Okay, I'm going to go to the next question then. Okay, this is a long question. Here we go. Generic resources are public agencies that are legally required. Did we do this one already?
Yeah, I think we should do it again just in case it's an important concept.
Generic resources are public agencies that are legally required to provide services to individuals with developmental disabilities. So free community-based nonprofits are not a generic resource. Please keep that in mind when telling families they need to go to generic resources first. Many families were charged family cost share all throughout the pandemic. What do you suggest they do to be reimbursed?
Good distinction around generic resource, private resources, free resources in the community. and know that our values, when that process does occur, if there are existing resources, our service coordinators will help support and advocate in making sure families are getting connected or working with Family Focused Resource Center to help to identify if there are existing resources there in that piece. So really good distinction. And then the second part of that question, Jennifer, is?
With regard to being charged family cost share throughout the pandemic, what do you suggest they do to be reimbursed?
For FCPP, we're going to validate, but we're going to check the sunset date on the family cost participation because it has been suspended during the pandemic. So we'll get clarity on that sunset date. So I wouldn't be aware of a retroactive piece there for FCPP for family cost. And we'll validate that sunset date as well.
Okay, next question. If these services are requested, must they be in the IPP?
Yes, any service or support that we authorize, or even if it's from generic or private, has to be included as part of the plan in the IPP. So everything has to be in the IPP.
Next question. They are asking for your contact information, Dr. Weller.
I think it's in the chat there a few times.
Great, thank you.
We can put it again.
If we could, that would be great. Let's see. I am a provider in the AV area. We take pride in getting our residents out on outings, yet our resources are very limited. If you have more resources in the AV area that you can provide me with, I would appreciate it very much.
Absolutely. We will get those resources available. We have a great working relationship with AV Seed and Grow and also our Family Focused Resource Center. And we'll collaborate in terms of what we have existing, and then also being very careful as we get new interest and new providers in those areas that we're promoting, and getting that information out there into the community as well, because we know how important it is.
Next question. If it is not for fun or leisure, how does it still apply for respite?
Respite's a family support. So the objective of a family support service is to give the family or parent or caregiver the care, the relief from the care and supervision. It's planned relief from the care and supervision, so that family member can get a break, and then that individual parent caregiver can get the relief that they need. So that's the objective for a family support service.
The next question is horseback riding, which is non-medical therapy round-trip transportation, reimbursed to parents if service is approved by the regional center?
The transportation, I think we're going to explore a little bit, because I think it prompted some good questions around non-medical transportation versus specialized. So we'll take that feedback as well and work with the team and get that information out to our community as it relates to mileage or mileage reimbursement. I want to explore a couple things there based off of the feedback that came in today. So we'll get some information there, some additional information in that area.
Okay, the next question. I understand that recreation services are not medical, but some clients, due to their medical condition, would have to request horse therapy, aquatic therapy, because there is no other category or vendors that can be requested. My question is if there are exceptions for each client.
We do have exceptions in our service standards that are there because regional centers know and have to plan that we can't anticipate every unique circumstance that comes up, just given the unique nature of the disability or the impact. So there are exceptions. The exemption is that regional centers are prohibited from purchasing an experimental treatment for the purposes of clinical therapy or treatment purposes. And so that still exists. And so that would take an exemption process to demonstrate why we would have to approve something that we're not supposed to for those purposes. And we would have to work really closely with our clinical team in those situations that come up around aquatic therapy or those kinds of treatments, because the Lanterman Act, even with this restoration, still says that we're prohibited from doing so because of that nature. And then we're not putting judgment if they're experimental or not, because there's research that supports value in those. And there's some good research that's been done. It's just that their research today in the Lanterman Act aren't aligned with that piece of it. And so what we're able to do is offer it as a non-medical therapies as a socialization or as a family support. We're not able to as a, we're prohibited from those experimental treatments. But if there's a certain circumstance that is unique that requires this, that would go through the program planning process and you would let your service coordinator know.
Okay, we are done with the questions in chat. So we're going to move back to the Q&A. And Sylvia, would you mind asking the next question?
Sure. This question is from Adriana Castillo Montoya. She says, I understand that swimming and music classes are part of non-medical therapy and fall under recreation services. Is that correct?
One more time, so I'm sorry, it's got another message coming in here.
Sure, no problem. I understand that swimming and music classes are part of non-medical therapy and fall under recreation services. Is that correct?
It could be. So a swimming class or some sort of activity in the community that involves some sort of social recreation component could be considered social rec. A social rec, or North LA, we could also think of it, depending on the objectives, as a family support. So are they going to learn skills, or is it to give the family relief from the care and supervision? What's the objective?
Okay, the next question is from Josh Kaplan. If a parent is using camp as a daycare, will we fund for transportation to get the child home if parents are still working when camp ends and they still need a daycare at home, especially during the summer?
We're going to take that back with the transportation conversation. I want to do a little bit more consultation around transportation and mileage based off of some of the questions coming in today. So we're going to take that feedback back, and we're going to meet with the team here to identify some of those really good examples that are coming up today for these situations. So we'll get some more information there for our community.
And may I share just some additional information, because while I wish we could use financial management services as a mechanism to fund for social rec as an alternative to the 024, we cannot. I just confirmed with community services that it has to be through the, other than through vendorization, the other option is through the, and I'm sorry, I'm using regional center service code language, but it's through, the mechanism would be through parent reimbursement. So, which would, as we explained previously, require the parent to purchase a service that was agreed upon in the IPP, but not yet available through vendorization, and then be reimbursed for that purchase of service. Jennifer, where are we with questions?
Okay, the next question was an anonymous attendee and was just asking if a recorded version of this presentation will be available in the future. It is currently available on our website, and the links were shared in the chat.
I will put those links in again.
Yes. One more question here from BVB. I want to send my not yet verbal child to a speech-centered camp in Culver City. Even though we are a member of North Los Angeles Regional Center, could he attend that camp? I believe that camp already vendors for the Culver City Regional Center area.
We can support that. So that's what we talked about earlier on the out of areas. So if there's an out of area vendorization and we can work with them, and your family's either willing to drive to that catchment area, or if staff's willing to come to us, we would be able to support that.
Next question is from Taline, and excuse my pronunciation of your name, Pachtatorian. How are assessments and outcomes measured in inclusive camp recreation environments?
That's a good question to bring forward. We can, with community services, as they're going through that vendorization process with providers, looking to see how they're going to demonstrate within their proposals of what they're going to do within their specific activities their outcomes and their objectives that they're proposing to do, how they're going to measure that, and what that will look like in terms of reporting. Typically, we see those progress reports or status updates that are coming in. So that will be something that we can build into our process. And then we'll have to work very closely with whatever entity, if they're not vendored with us, to understand effectiveness, progress, to make sure that we're getting feedback, because some programs may not do that written progress report, I would imagine, the same way a service provider may. So that's why we're going to have to do program planning and hear from individuals being served and from their support team and from their parents about those successes and what's working well or what needs to be looked at. So it'll be a collaborative process, but we're thinking about those elements already for both for service providers and also for the community based programs.
Okay. AV Seed and Grow. Dr. Weller, will there be exceptions made for overnight camps not available in our catchment area? Because they can't simply be reproduced locally, such as Easter Seals Camp in Big Bear or Camp Pavikia?
I would go through the I'm looking at my team here to make sure I say the right thing. I would say we would go through program planning and assess it, that if there is a camp or a service that's vendored that works for the individual and they're with another regional center, we would support that. And the same way, and part of the rationale would be if we don't have the resources here to meet it in our own catchment area, which we always try to explore first, then we would look at other regional centers and other things and support that. We want people to be in these programs. We don't want to be restrictive. And so I think as we can not only do out of areas, but partner with our other regional centers and collaborate with each other, I think it's in the best interest of the people we serve. So those types of requests, I would even say are exceptional. They would just go through routine program planning for to achieve those needs.
Next question is from Adriana Castillo Montoya. Is reimbursement to parents for services being received through traditional regional center services as well? And I understand that in order for the reimbursement to be made, these services must be in the consumer's IPP?
Yes, yeah, we have to have agreement. And that's what we use. And that's what the department would be looking at if there was a retroactive payment made, is that there was agreement for that service. Otherwise, it goes outside of program planning and then it gets tricky. So really important that you talk with the service coordinators, that we have agreement in the IPP or the addendum, which is a change to the IPP that documents the agreement, that plan, that objective, that outcome. And then for the 024 process would be the proof of payment, whatever that amount is, to be able to provide, that could start that process there. So that's my response for that question.
Thank you. The next question is from Tracy Tyndall. Can a provider receive a copy of an applicant's conference informational webinar for a current RFP that was missed?
I don't know the answer to that one. That looks like a community service possible type question, an applicant's conference. I would say maybe our resource, or Maria.
Yeah, so I'm sending the information to Tracy in our website. There are the applicant's conference there, the information. So I'm going to go ahead and send it in the chat.
Thank you. And I think we have time for another question or two. I know we went over, but it's such important information. I'm glad we got the opportunity, and thank you. We still got 74 people on with us, which is fantastic.
Great. And may I make an announcement very quickly, Jesse, before we, because just to make sure, we're going to put an address or an email address in the chat. So for anyone that's going to reach out to Dr. Weller directly, you're going to see his email in the chat. If you could please copy his executive administrator.
Ruth, I'm sorry, you're fading out. We did not hear what you said.
Oh, I said I'm going to add an email address in the chat for anyone that's reaching out to Dr. Weller.
Apologies, your microphone is not working well.
I think I can do it, Ruth. I think for, I can help. In the chat, we're going to put Sandra to help me track the emails. I get a lot of emails every day. So we're going to get Sandra's help. If you can include Sandra and myself on there, just to make sure that we're getting through any response that comes to me directly. We want to make sure that we get back to our community on any of the questions. And this will be recorded today too, I see. And we're on Facebook Live, it looks like. So we'll get this information out to the community. And then let's see if there's any other final questions. I want to make sure we get to all the questions. Is there anything left in Q&A before I close out Q&A?
There is one.
Sylvia, can you help me with that one?
Yes, 1 second. Is the reimbursement to parents for, I'm sorry, traditional services? Christina, would you mind helping me out with this one? I'm not sure I'm understanding it correctly.
Yeah, I think a parent is asking if the reimbursement for parents is through traditional services.
Yes, in this example, it would be. If there's a service agreed upon for camp social record on medical therapies, and then we do a reimbursement. Otherwise, if it was self-determination, for example, then it would go through the FMS and the spending plan, a little different process.
And Jesse, are you able to hear me?
No, I can't, yeah.
Okay, I know I'm getting really close. I'm sorry. It's a microphone issue with my laptop. So, but there's an important comment in the chat that I would like to address. And that is the regional center's use of the term generic resources and individuals needing to first seek services through a generic resource before the regional center is able to fund for a service. And I just want to clarify. So in the Lanterman Act, it requires regional centers to identify and pursue all sources of funding that provide, well, it says generally pursue all sources of funding for consumers receiving regional center services. So when we're program planning, we're looking in the community and we're looking at all potential resources. Now, in the Lanterman Act, it says that these potential resources include generic resources, which are governmental or other entities or programs that have a legal responsibility to provide services to eligible individuals. And I'm paraphrasing, I'm not citing the Lanterman Act verbatim. So an example of a generic resource is a school district or Medi-Cal. And then there are other sources of funding like private health insurance, which has a legal responsibility to serve or provide services to an individual that's eligible for that. Now, these are included in this statute. They're not the sole types of programs that we must pursue or seek. So if there is a resource in the community that's available that could serve an individual or meet a need in the IPP, the Lanterman Act would require the planning team to consider that service as well. So I just want to clarify that. And then the other comment or question that came up in the chat was for a parent who was receiving services during the pandemic while a child is home, engaged in social or distanced learning. Can a parent request reimbursement if they paid a share of cost for that service? So share of cost for services applies to daycare services. And so if a parent was receiving daycare services during the pandemic and was required to pay a share of cost based on the criteria, then that is how that would apply. Now, what was stated in the comment or the chat was that the service was being provided while the child was participating in school. And that service, we should have been personal assistance services. So, so I'm not certain if there were circumstances that would have resulted in authorizing daycare services to support a child with social distance learning. So but that would have to be evaluated. So if it was a daycare service, then a share of cost applies. If it's personal assistance to support the child at home, then it would have been, then there would not be a share of cost. Now, a circumstance where potentially I could see daycare being the service authorized would be in a circumstance where both parents were working outside of the home and therefore were not available to provide care and supervision to their child. And I'm going to look to Gabby and Christina to see if that would be the circumstance where daycare would have been the service authorized rather than personal assistance.
Yes, because there isn't share of costs for personal assistance, just for daycare.
Right. Okay. All right. So I just wanted to clarify there. And I think that covered it for that particular question. Okay. There. Oh, and I know we have run over. We're at 3:40.
Is there any other? We'll take a look too. I think we got through, there was a lot of content here. I think we got through the chat. Thank you to the team and everybody assisting to make sure we get through. I think at this point, if everybody's okay, I can do the closing, if that works for everybody. And I will just say thank you. And I want to acknowledge, I know this is a lot of information, but these town halls are so important and so effective for us, for Regional Center, because the things that you bring forward today lets us go back to the table and talk and figure out processes to put materials together for our community. So this is all unfolding. It's unfolding, and so we're trying to implement, and we want to do the right thing. We want to get this out as quickly as we can, and we want to make it as inclusive and easy to access as possible for everybody that we serve. So we're going to continue to work and partner with all of you and our community-based organizations and our Family Focused Resource Center to get more information, and we'll continue to build. And the teams, just so you know, are tracking when there's certain requests or certain unique situations that come up, because we can't anticipate everything that is going to unfold as we implement this, that we're tracking it and then getting it memorialized. That way we have processes for when these requests come up. So we want to thank you. I hope you found today helpful as one of our beginning conversations. You'll have access to the PowerPoints, our materials on our website, our service standards. And then please reach out to us if there's ideas, recommendations, suggestions, things that we should be thinking about. We would love to hear from you. And I think there's a survey coming up as well. But thank you on behalf of the Regional Center, all of you for making time and for being here today. And that concludes our town hall for today. And thank you to our staff that supported, and to all of our families and individuals that showed up today.
Thank you, everyone.
Buddy.